Addison's disease. Imagine you have a pair of superhero friends called the adrenal glands. These glands, located on top of your kidneys, have two important jobs: producing cortisol and aldosterone hormones. But in Addison's disease, these adrenal superheroes are feeling a bit lazy, like they're hitting the snooze button too often. Cortisol is like the body's main stress hormone. It helps regulate metabolism, blood sugar levels, and the immune response. Aldosterone helps maintain the right balance of salt and water in the body. But when Addison's disease strikes, these hormones become deficient. It's like your superhero friends decided to take a vacation when they should be on duty. As a result, your body can't respond well to stress, and things start to go haywire. You might experience symptoms such as extreme fatigue, muscle weakness, unintentional weight loss, low blood pressure, dizziness upon standing, and sometimes darkening of the skin, especially in areas exposed to the sun. To treat Addison's disease, we need to fill in for the missing superheroes. Doctors often prescribe hormone replacement therapy, which involves taking medications that provide the cortisol and aldosterone your body needs. It's like hiring reliable substitute superheroes to take over the job when the original ones are slacking off. Cushing syndrome. Now let's shift gears and talk about Cushing syndrome, which is quite the opposite of Addison's disease. In this case, your adrenal superheroes are working overtime, like they've had a few too many cups of coffee and can't calm down. Cortisol, the stress hormone we mentioned earlier, is produced excessively in Cushing syndrome. It's like having a friend who shows up to every event uninvited, dominates the conversation, and eats all the food. This excess cortisol wreaks havoc on your body. You might notice symptoms such as weight gain, especially in the face, upper back, and abdomen. The face can become round and full, resembling a moon face. Your skin might become thin and fragile, leading to easy bruising. Stretch marks may appear on your skin, and wounds might take longer to heal. Additionally, you might experience high blood pressure, muscle weakness, and mood swings. The treatment for Cushing syndrome depends on the underlying cause. It's like trying to calm down that hyperactive friend at the party. If the excess cortisol is caused by long-term use of corticosteroid medications, the dosage might be reduced gradually. If a tumor is the culprit, surgery or radiation therapy could be necessary to remove or shrink it. Remember, Addison's disease and Cushing syndrome both involve the adrenal glands and cortisol, but they represent opposite ends of the spectrum. Addison's has too little cortisol and aldosterone, while Cushing's has too much. The symptoms reflect these differences.